Welcome, I'm Melissa Brothers, Surgical Technician Instructor. In this video, you will learn how to catheterize an intubated patient. Intubation is a procedure that can help save a life when someone can't breathe. An endotracheal tube keeps the airway open so air can get to the lungs. Intubation is usually performed in a hospital during an emergency or before surgery. Catheterization can be used when a person cannot empty their bladder without assistance, either permanently or on a temporary basis, such as during or after certain kinds of surgeries. It is important to know how to catheterize an intubated patient. Let's go through the steps. First, wash your hands and assemble the necessary supplies. Stand next to the bedside and position a garbage can or a kick bucket close to you. Position the patient's legs so that you have access to the groin area. Confirm either verbally with the patient or on their chart that they have no allergies to latex, betadine, or tape. Open the kit. Pick up a sterile glove packet and move to an unsterile area. Put on sterile gloves. Drape the patient with a towel and fenestrated drape to create sterile field. Prepare the setup, which includes lubricant and prep. Check the balloon prior to insertion. Connect and inflate the balloon to 10 cc's. Then deflate it, making sure to remove all of the liquid. The typical size of catheters for males is 14 to 18 French. For females, it's 12 to 16 French. 16 French is the most common size for both. For females, spread the labia with your non-dominant hand. That hand is now contaminated. Prep the area utilizing 3 strokes, the sides first, and then the middle from top to bottom. This is done with 3 prep sticks or cotton balls. Discard these items in the garbage. For males, grasp the penis with your non-dominant hand. Again, this hand is now contaminated. Prep the area in a circular motion from meatus to periphery. If the patient is uncircumcised, foreskin is retracted back to clean. After catheter insertion, the foreskin must be moved back to its normal position. Then lubricate the tip of the catheter prior to insertion. Insert the tip into the meatus and advance. This is about 4 inches for females and 10 inches for males. The typical length of the urethra in females is 1 to 1.5 inches. For males, it's 6 to 8 inches. Next, observe and state observation of urine prior to the balloon inflation. If urine does not flow, put pressure on the abdomen. If there is still no flow, do not inflate the balloon and notify the surgeon. If urine is flowing, inflate the balloon with 10 cc's water and seat correctly. Using water prevents the balloon from failing. Then position the catheter. If the patient is supine, position the catheter under the leg with a towel for padding. If the patient is lithotomy, put the catheter over the leg. Secure the catheter to the leg with tape and maintain the Foley bag below the level of the bladder. When it's time to remove the catheter, deflate the balloon prior to taking the catheter out. You've now seen the process for inserting and removing a catheter. For this, like other procedures, confidence comes with practice. To learn more, look for our other videos on medical techniques and procedures.